Today we're going to be talking about sensitivity after having a filling or a crown done. Hello everyone, my name is Dr. Anand Choubal and welcome to the Dental Corner. For me as a dentist, having worked for over 20 years, very disturbing. And disturbing in the sense that I get in there to do nice dentistry and we make this nice pretty looking tooth out of filling material. We feel very proud of ourselves, and then the patient, we get a call back from them saying that their tooth hurts and that they never had that pain before. One of the last cases I had this happen was approximately 2016, and since then I have been trying to unlock how to prevent this as much as possible. So far, here's what I found out. When you drill a tooth with a drill to fix it, it creates inflammation inside the tooth. And this pressure that increases inside a hard tooth is not so easy to get back down. And there are bite forces that keep that pressure elevated. So what I have found is if you've had a filling, if you've had a crown, the tooth has had some trauma. Most importantly, try and keep your teeth apart as much as possible throughout the day. Most of us will clench and grind and not even feel it. Just kind of like our socks on our feet. They're there all day, every day, but we don't really feel them. Clenching and grinding is just as subtle, but after you've had a dental procedure, quite harmful. Secondly, anti-inflammatory like Advil, if you can take it, is excellent if taken consistently at normalizing the internal pressures of the teeth that were worked on so that they feel normal again. My opinion, the best time to start this is when you're still numb, because the inflammation is present, but the numbing doesn't allow you to register any discomfort. So start taking the Advil every 6 to 8 hours. Typically, I will advise the patient how many days to do it for, anywhere from 1 to 2 days all the way to 7 days, depending on how much trauma the tooth received. Also depends on how much bite force I think you're putting on your teeth. For more extreme cases, we will also add a mild dose of a muscle relaxant to be taken at night for approximately 14 days to minimize those bite pressures at night, again, because we all clench and grind. Following all those instructions together, we find that we all have almost no complications. Now, they still happen. Some people still have sensitivity. Some people still need a root canal after having a filling or a crown. But it happens maybe one patient in a year or even in 2 years will come back with that experience. Whereas back in the early 2000s when I started this, it was almost 1 in 5 teeth had some issue after we touched it that the patient didn't have before. And for me, I really didn't like it. For the patients that lived through that, I'm sure they didn't like it either. So over time, we have developed a fairly nice recipe so that you can have a procedure done, follow our instructions, and not have to suffer after. Of course, the hardest part about all of these instructions is following them even if you don't have pain, because inflammation can be present without the presence of pain. If we attack it aggressively, the inflammation that is, now you can return to normal as if nothing happened much quicker. And that is satisfying.